Hello everyone and welcome back to the channel. If you've recently been prescribed hydroxychloroquine, perhaps for lupus, rheumatoid arthritis, Sjogren's syndrome or another autoimmune disease, you may have lots of questions. What exactly is hydroxychloroquine? How does it work? Is it safe? What are the side effects? Can it damage the eyes? And do I really need annual eye screening? In this video, I'm going to explain everything you need to know about hydroxychloroquine, including how it works, why rheumatologists use it so frequently, what conditions it treats, its benefits, potential risks, and why, despite concerns about eye toxicity, it remains one of the most valuable medications we prescribe in rheumatology. I'm Dr. Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology London. Hydroxychloroquine, often shortened to HCQ, is one of the most commonly used medications in autoimmune disease. Many people are surprised to learn that it was originally developed as an anti-malarial medication, but doctors soon discovered that it also has important effects on the immune system. Over the years, it has become one of the cornerstone treatments in rheumatology, particularly for lupus, but it is also widely used in rheumatoid arthritis, Sjogren's syndrome, undifferentiated connective tissue disease, and various inflammatory arthritis. One of the reasons rheumatologists like hydroxychloroquine so much is that it has a very favorable safety profile compared with many other treatments that we use. It isn't considered a powerful immunosuppressant. It doesn't usually increase the risk of serious infections. It doesn't require frequent blood monitoring like methotrexate, and many patients take it successfully for years or even decades. Now, the obvious question is, how does hydroxychloroquine actually work? The answer is that we still don't fully understand every aspect of its mechanism, but we do know that it helps regulate the immune system and reduce abnormal inflammation. In autoimmune diseases, the immune system becomes overactive and begins attacking healthy tissues. In rheumatoid arthritis, it causes inflammation inside the joints. In lupus, it can affect multiple organs throughout the body. And in Sjogren's syndrome, it targets glands responsible for producing tears and saliva. Hydroxychloroquine helps dampen down this inappropriate immune activation. I often explain to patients that it's rather like turning down the volume on an overactive immune system. It doesn't switch immunity off completely, but it helps calm things down and restore some balance. Perhaps the disease where hydroxychloroquine has had the biggest impact is lupus. In fact, many lupus specialists would argue that almost every patient with lupus should receive hydroxychloroquine unless there is a very good reason not to. This is because hydroxychloroquine appears to do much more than simply improve symptoms. Research has shown that it can reduce lupus flares, decrease long-term organ damage, lower cardiovascular risk, reduce the risk of blood clots, and even improve overall survival. It can also help reduce the amount of steroids patients require, which is hugely important because we know that long-term prednisolone can contribute to osteoporosis, diabetes, cataracts, and many other complications. Hydroxychloroquine is also commonly used in rheumatoid arthritis. Some patients with mild disease do very well on hydroxychloroquine alone, while others take it alongside methotrexate. In fact, hydroxychloroquine forms part of what we call triple therapy, where it is combined with methotrexate and sulfasalazine to achieve better disease control. We also use hydroxychloroquine in Sjogren's syndrome. Whilst results can vary between patients, some people report improvements in fatigue, joint symptoms, and general well-being. It is not a miracle drug, but for the right patient, it can make a meaningful difference. One thing patients often find frustrating is that hydroxychloroquine doesn't work immediately. Unlike prednisolone, which can produce dramatic improvements within days, hydroxychloroquine takes time. Most people start noticing benefits after around 6 to 12 weeks, although for some individuals it can take 3 months or even longer. I always tell patients not to judge hydroxychloroquine too early. It is very much a slow and steady medication. It builds up its effects gradually and often works quietly in the background to prevent inflammation from escalating. The most common dose prescribed is 3 milligrams once a day, although some patients take 100 milligrams per day. Increasingly, dosing is based upon body weight because we know that higher cumulative exposure over many years may increase the risk of retinal toxicity. This brings us on to the subject that most patients want to discuss, the eyes. Hydroxychloroquine has become quite well known because of concerns surrounding retinal toxicity. Patients frequently arrive in clinic worried because they have read stories online suggesting that hydroxychloroquine causes blindness. Fortunately, the reality is much more reassuring. Retinal toxicity from hydroxychloroquine is relatively uncommon, particularly during the first 5 years of treatment. When the medication is prescribed at the appropriate dose and patients undergo regular eye screening, the overall risk remains very low. However, because retinal damage can be irreversible if it occurs, monitoring is extremely important. In the UK, patients taking hydroxychloroquine are usually referred for specialist eye screening after 5 years of treatment, although certain individuals at higher risk may require earlier assessment. Ophthalmologists use specialized scans which can detect very early retinal changes before patients develop symptoms. This is incredibly important because once symptoms become obvious, damage may already have occurred. The whole purpose of screening is prevention. Patients often ask me what symptoms they should watch out for. Changes in central vision, difficulty reading, blurred vision, missing areas in the visual field, or difficulty seeing in dim lighting should always be reported. That being said, I want to emphasize that the vast majority of patients taking hydroxychloroquine never develop significant eye problems, particularly when screening recommendations are followed. Aside from eye monitoring, hydroxychloroquine is generally very well tolerated. Some patients experience mild nausea, bloating, or abdominal discomfort when they first start treatment. Taking the medication with food often helps considerably. Occasionally, patients may notice headaches, mild dizziness, or skin rashes, although these side effects are usually manageable. Compared with methotrexate, hydroxychloroquine is often much easier for patients to tolerate in day-to-day life. Another question I hear regularly is whether hydroxychloroquine weakens the immune system. The answer is not really. Hydroxychloroquine modulates immune activity, but it does not profoundly suppress immunity in the same way that some other medications do. Patients taking hydroxychloroquine alone are generally not considered significantly immunocompromised. Hydroxychloroquine is also one of the medications that we are usually comfortable continuing during pregnancy, particularly in lupus. In fact, maintaining good disease control throughout pregnancy is incredibly important, and hydroxychloroquine has an excellent safety record in this setting. Perhaps one of the most fascinating aspects of hydroxychloroquine is that it may provide benefits beyond simply controlling autoimmune disease. Studies suggest it may improve cholesterol profiles, reduce cardiovascular risk, lower thrombotic risk, and even improve glucose metabolism. This may partly explain why lupus patients taking hydroxychloroquine appear to have better long-term outcomes. So what are the key messages I would like you to take away from this video? Hydroxychloroquine remains one of the most important medications we have in rheumatology. It is widely used in lupus, rheumatoid arthritis, Sjogren's syndrome, and other autoimmune conditions. It is generally very safe, very well tolerated, and highly effective in the right patients. Eye monitoring is important, but when screening guidelines are followed, the risk of serious complications remains very low. Hydroxychloroquine is not a medication that works overnight. It requires patience, but for many patients, it becomes a treatment they take successfully for years and one that significantly improves their quality of life. If you've recently been prescribed hydroxychloroquine, don't be alarmed by some of the information you may read online. Understand the risks, attend your eye screening appointments, ask questions, and stay informed. For many patients, hydroxychloroquine is a remarkably effective medication that quietly plays a major role in controlling autoimmune disease and protecting long-term health. If you found this video helpful, please like, subscribe, and share it with anyone who may benefit. For more videos on lupus, rheumatoid arthritis, and osteoporosis and rheumatology treatments, please make sure you subscribe to the channel. Thank you very much for watching.